Hello, everyone. It's good to be with you again. I'm excited to have an important conversation today, especially as we are observing in October Pregnancy and Infant Loss Awareness Month. So I'm joined with three incredible women who are going to share their stories and their experiences and really bring this conversation forward as it should be. So I'm going to get the conversation started now quickly with you, Erica, and then we'll bring in Dana and Emily. Please introduce yourself a little bit and then tell us, why is it so important that we normalize talking about pregnancy and infant loss?
Hi, Lauren. Thanks. My name is Erica Wilson-Domer. I use she, her pronouns. I'm the president and CEO at Planned Parenthood of Greater Ohio. And I have my own personal story about pregnancy loss, as why I'm joining this conversation today. And part of why I think it's really important is for so long, there's been a stigma associated with pregnancy loss. And I think women have been made to feel like they are somehow to blame or that they've done something wrong in the course of getting pregnant. And I think it's really important for us to be able to share our stories, really destigmatize pregnancy loss, but also to help each other heal from such a traumatic event. I think words matter and conversation matters. So that's why I'm joining today. And I appreciate the opportunity to do so.
So I am Dana Langford. I have the pleasure of being a certified nurse midwife, but I also have the privilege of serving as the CEO and founder of Village of Healing and the Village of Healing Center. Echoing Erica, I think it's about community, right? It's recognizing that I'm not the only. It's recognizing, even just for miscarriages, that 20% of pregnancies usually end in miscarriage. It's hearing the conversation that I didn't do anything wrong. I think a lot of times, especially in womanhood, we're taught that motherhood is the ultimate woman. And so when people have a loss, whether it's a miscarriage or a loss past 24 weeks or 20 weeks, we feel like we've done something wrong and we're undeserving of being that woman and we've lost that womanhood. And so it's just having the conversations that there's nothing wrong with you. And so, how do we bring that community together? How do we bring that healing circle together? And how do we take a focus off of it being based off of womanhood equals motherhood? And if I don't do this, then there's something wrong. I think that's why it's important to have the conversation.
Emily Savers, and I am delighted to be here. I can say that several decades ago, my life was forever altered by the loss of multiple pregnancies. My girls are now 9 years apart because of that, and it was absolutely not something that we planned. And throughout my adult life, reproductive freedom, reproductive choice has been an option for women. And as that is threatened, I realize that I need to speak up more, that what is important and what happened to me happens to a lot of women. And it is essential that for our own health and safety, we have the option to make those choices. So I was very proud in 2023 to be part of the Planned Parenthood campaign and to tell my story then.
So I know we have many personal stories here today. Erica, can I pass it back to you to share more of your personal story? And then I really welcome Dana and Emily to jump in too. Don't wait for me, but it's okay if you do too. No worries.
Sure. Thanks, Lauren. And again, I appreciate the opportunity to share my story. So the first time I got pregnant, I always like to call my oldest son an unexpected gift, right? I had actually just had emergency surgery because I had a tortious cyst on an ovary and lost an ovary. And then was 6 weeks later, I was pregnant with my first child. After they told me I would have problems getting pregnant, lo and behold, here I was. And that pregnancy, although I won't say it was easy because I had its own, every pregnancy is different and has its own set of complications. I noticed from some members of my family, and I won't call them out in a public space, but that they were nervous to be excited, that they didn't really want to be excited. And they cautioned me a lot, like, well, you don't know what will happen. You got to wait, and that was a little tough because I wanted to be joyful, even though this was an unexpected gift. I wanted to be joyful about it. But their nervousness made me nervous until I spoke to a friend of mine who said, you know what? Something might happen. Something often happens, but enjoy this moment and feel this joy while you can, because, we're just not promised tomorrow, no matter what the situation is. And so I took that to heart. And I was very fortunate that I had a healthy pregnancy and had a healthy child in the end after some different challenges. But 4 years later, my husband and I decided that we wanted to try to have another child. And I knew I might have difficulties because I had one ovary at the time. Um, but we tried. We were fortunate that I finally was pregnant. And after a lot of difficulty trying to get pregnant, I was so excited. And I really thought, oh, this is great. Here I am. And then probably, but I would say that I really kind of felt from the beginning that something wasn't quite right. So I was having a little bit of spotting. There were just some different signs that were but again, every pregnancy is different. And so I kind of knew people who'd had some different symptoms that I had had, and, they went on to have perfectly fine pregnancies. So, when I did go to see the OBGYN and we were able to do the ultrasound, they realized that although I was pregnant still, there was no heartbeat and the pregnancy was likely not viable. I was not going to continue. So after a couple of visits, we had to make the decision to do a DNC to remove the tissue from my uterus so that I could go on. And it was devastating because we had been trying and trying, and we were really excited to have a second child. And I had allowed myself to feel that joy. And what I discovered in that time was that for me, it was the morning of the potential, right? So although I hadn't bonded to a fetus or a baby or anything yet, what I was bonded to was the potential, was the potential future. And that was what I had to mourn. And it was really hard because I had some colleagues at the time who were also pregnant and they were continuing with their healthy pregnancies. So every time I would go to work and I would see them progressing, it would just remind me of what I lost. Right. But also I knew that I was going to try again. I mean, I think that was something that I knew, that even though that was hard, that it was important to me, to try again. I mean, ultimately, my husband and I had made, the decision that we would try again, and we were open to adoption. We were open to other things, but we wanted to try again and see what happened. So we did. And, I was really fortunate the second time around. I did get pregnant, and I was pregnant with twins. In the end, I was very fortunate that for me, it worked out. Although I will say part of the reason we spaced our children apart was we didn't want to have two in daycare and two in college and then, as life so often does, your best laid plans, it laughs in the face of. But this is why my children are 5 years apart, because, there was a whole year that we spent trying where we thought we were. So it was really tough. I had a number of family members and a number of colleagues and friends who were pregnant at the same time when I lost that pregnancy. And it was, I felt joy for them. And I found at that moment that both things can be true. You can feel joy for your friends and your colleagues and your family members, but you can also feel deep sadness, right? And I felt that. I remember having that moment of breaking down with my husband at one point when a family member found out that they were 5 months pregnant and they hadn't even been trying. And I'm like, why is this so hard? Why is this so hard? Right. And feeling really joyful for that family member because I knew that this what was meant for them and that it was really exciting. And then feeling guilty too, feeling guilty like I was being selfish for my own sadness about our situation. So it's such a complicated subject to me, this issue of pregnancy loss. And you feel so many different things all at the same time, and trying to parse through those feelings. And there's what you feel, what society tells you should feel, all the different things that kind of come into play. But in the end, I'm very fortunate that I was able to have 3 healthy children. But I also have friends who that was not the case for, and they suffered a number of different pregnancy losses, and it was really challenging every time. And still to this day, they grieve, and still to this day, they really struggle with that.
I think Erica says something that I always, as a nurse midwife, get in our new OB appointments. I'm not going to tell anybody until I'm 13 weeks. And I think that, it's that wait till you get out the first trimester before you celebrate. And it's usually a family member or a friend that's telling you that. And I always tell people, because I know it is so hard to get pregnant, right? Like we see people doing it every day, all day. And so we're like, oh, this is just something that happens. And so as a midwife, I've learned all the cards have to be aligned perfectly in order to get pregnant. And so you are allowed to celebrate that. And I'm, like with Erica's friend, yes, something can happen, but it can happen at any point in the pregnancy. And so those are the conversations that we don't have, and we shouldn't necessarily. However, celebrate, be happy. There's nothing wrong with feeling joy about something that you wanted. A lot of times you prayed for and it's happening. But then we also have to learn, I think, how to grieve. And I remember as a nurse midwife, the first time I told someone that either they had a miscarriage. I remember that moment. And then I also remember the moment that there was a 34-weeker that had come in for her normal appointment and we couldn't find heart tones. And I remember praying in that moment, like, I don't ever want to get to a place where I'm dead into this. And I think a lot of times, as patients and as providers, we tend to do it more often. And so we get to a place where we talk from a scientific perspective and we don't recognize that these are humans in front of us. And so it's so important, I think, to have these conversations to remind us as providers that these are human beings that are going through this, and mothers and fathers and siblings and everybody that are going through this. And it's just important, again, to have that community. And then I remember the moment that I learned that, as far as Black infant mortality was concerned, that if the numbers were equal, 10 years ago, 460 kindergarten classrooms of Black children would have been saved. And for me, that was such a stark number. And to know that that disparity was there and there wasn't a lot of conversation about it. And to know that in this state of Ohio, for every one white baby that dies, 3 Black babies die. And that's huge, right? And so we have to have the conversation and we have to do it in order to even come up with the policies to figure out why it's happening. How do we change the culture of healthcare? How do we change the culture of the conversations so that we're able to change the numbers and truly make a difference in people's lives?
Dana, can you share more about what you think we need and services to be that wraparound community support for pregnant women and for Black women especially?
What we're learning is that it's all about support and community. As a nurse midwife, I'm going to speak and be very frank. First and foremost, we have to hold institutions and we have to hold providers responsible. And so the policies need to start from an institutional perspective. And what we mean when we say that, especially when it comes to Black women in particular, the bias trainings and then the anti-racism trainings. We know, especially for Black women and Black families, that entering into the healthcare system, I've already encountered probably the likelihood of a criminal justice system. I've encountered a generational wealth gap. I've encountered the school system. There are multiple systems that we encounter where the disparities are increased and there is racism in those systems. And so I'm bringing all of that life experience into then healthcare. And God forbid, I've had a horrible experience in healthcare, either myself or my family member. And so teaching that in the healthcare systems, I think is huge. But also because as Black women, we're disposable. As women, we can be disposable in those systems. And so we have to hold those systems accountable. And so what policies can we implement? But then in addition to that, providing support. So community health workers, doulas, recognizing the resources in the community. so that pregnant women and pregnant birthing people know what's available to them. And so they're not encountering these systems alone or with their partners, scared, afraid, or like Erica said, being told you can't celebrate until 13 weeks. But they have individuals in the community that can support them, that can answer their questions, that can help them, but also help them advocate. I know we're really big on self advocacy. And as someone that was recently sick and had to be rushed to the hospital, I remember my friend saying, "Did you say this? Did you say that?" And I'm like, y'all, I felt like I was dying. Like the last thing I thought about was how to advocate for myself. Like I wanted to be taken care of. And so teaching, I think, the community around us, teaching family members, so that when we enter into those systems in those most vulnerable places, we're not depending on ourselves to fight for ourselves. Like women are tired of doing that. Birthing people are tired of doing that. And so I think all of those things play into the role and will assist. And then also acknowledging the reasons that this happens, right? So the racism in healthcare, and everything else that play a role into it, acknowledging it, confronting it head on, tearing down those systems and rebuilding ones that are all inclusive and that are focused on caring for birthing individuals.
Lauren, I want to piggyback a little bit on what Dana said, because I do think there's racism and there's also a baseline of misogyny that happens in medicine. So even I had mentioned earlier that when I lost an ovary years ago, when I presented at the ER with internal bleeding, I was just treated like, oh, you probably just have to go to the bathroom. Go sit over here. Let's see if it passes. I was literally crawling in the door because I was in so much pain from the internal bleeding that was happening, although I didn't know it at the time. And I was treated very much like, oh, you probably just have gas or something. So just go wait over there. And it took quite a long while before somebody actually looked at me. It took quite a long while before somebody actually sent me for an ultrasound. And it really just demonstrated to me sort of that if a woman presents in an ER with any sort of abdominal pain, they treat you very much like, oh, go take a Tums, go do this thing. And it was really startling. But to Dana's point, in that moment when you're in so much pain and you're really struggling to get through that moment, you can't advocate for yourself. And quite frankly, you shouldn't have to, right? So I think it's the treatment of women in all systems, but most definitely in the healthcare system and how our bodies present. We're underfunded in research. We're underfunded in teaching. Giant gaps in the teaching of our providers around women's health, and particularly once you get out of reproductive age. Once you're done with reproduction, there is no training happening for anybody on how to treat a woman's body, which is also very unfortunate and speaks to the policies and the misogyny that is, I think deeply felt by most women and when they enter the healthcare system. And it's really deeply troubling and unfortunate. And I hope that these type of conversations can be part of changing that for the future. And I love what Dana is doing to help women really feel empowered in their care and help them feel like they really can take charge of that care. And I feel certain that my experience and even Dana's experience was probably different, Emily, than your experience. As you said several decades ago and experienced your pregnancy loss and how probably doctors reacted or how you were treated throughout that crisis. Because too, I think pregnancy loss, often we don't do enough investigation, particularly with multiple pregnancy losses. And I know that you experienced multiple, to get to the bottom of why is this happening, right? Like not just dismissing it, but why is this happening to a person? If you wanted to share a little bit.
So I had a 4-year-old daughter and we wanted to have another child, and I got pregnant pretty quickly and waited, till, I don't know, 10, 12 weeks before I started telling people, and because that was the norm, right? And, they found the heartbeat and all the tests were coming back just fine. And at 16 weeks, I started spotting. And so I went into the doctor and there was no longer a heartbeat. And that was devastating. So my work knew, my family knew, my friends knew, my neighbors knew, my 4-year-old daughter knew, right? Is of course you start talking about it. And so I had to tell everybody that it was over. The doctor said it really wasn't considered very safe to wait to deliver that fetus because it could get infected, which would jeopardize my life if it did. So the next day, had to go in for what they called a DNX, which I think is just a more complicated DNC because of the size of the fetus. And I walked in, and the physician who was going to do the procedure was like 8 months pregnant, and I just lost it. I was like, I cannot believe that that's what I have to look at, you know. But yeah, so I that pregnancy ended, and I was advised by the obstetrician just to try again. That it happens, and that it's bad luck, but it happens. So I tried again, and I got pregnant again, and then I was advised not to tell anyone until I passed 16 weeks this time. Since I lost one at 16 weeks, I should wait 16 weeks. So we did. It was hard because, it's my third pregnancy. I started showing kind of early, and people were wondering, and they were asking. And I'm like, like trying to pretend like nothing's going on. And, the heartbeat's fine. All the tests come back fine. I passed 16 weeks. I'm feeling really excited. I start to tell people. I start to go buy maternity clothes. And at 20 weeks, I'm with my mom here in Central Ohio. And I say, Mom, it just doesn't feel right. Something doesn't feel right. And so I went to the ER, and sure enough, again, there was no heartbeat. And this time they took it more seriously, and they suggested that it's a Saturday night, that I not terminate the pregnancy until I had met with my obstetrician. So I was to go in on Monday, and I woke up early Monday morning around 5 o'clock in labor. And I called them, and they said, labor usually takes hours and hours when you're at this stage. So come into the office at 8. Okay. I didn't make it. So I delivered a dead fetus at home. Had to call 911, had to get them to come help me. Did not deliver the placenta. So, of course, maybe I would have had to go to the hospital anyway. I don't know. I ended up at the hospital again. They had to deliver the placenta. And so this time they said, well, we should do some testing. And the testing will mean you can't get pregnant for a while, which was like the worst news. I'm like, what I want most is to have a baby, which means I have to be pregnant. So they did all sorts of blood tests. They were worried about blood clots. So they did something with the clotting in my blood and things like that. And they found nothing. They did a bone marrow sample. They found nothing. They looked at, inside my uterus. They found nothing. So they found nothing and said, try again. So I did. And I actually asked to see a specialist or a second opinion. And they sent me to an infertility specialist who explained that infertility means not being able to get pregnant. It also means not being able to carry a pregnancy. So I was labeled infertile. At that point, I didn't care, But so then I got pregnant 2 more times, and lost both before the first trimester. Did find heartbeats in them, but they didn't last, and I just miscarried naturally. So the 5th time I got pregnant, I made it to the 13 weeks and was transferred to a high-risk OBGYN. And I remember begging him to find out what happened. And he would say to me very gently, Emily, if I find out what happened, 80% chances I can't correct it and you'll never have a baby. But if I can't find out what happened, 80% chances you'll have a healthy baby. So I wanted to know, but he was telling me finding out. He was trying to find out, but he also said, if we do find out, that's not good news for you, right? That's not good news. I ended up having ultrasounds twice a week when I was pregnant for my 5th time. At that time, and I don't know what the science is now because my daughter is now 24 years old. He said, if you pass this fetal stress test, I guess is what they called it. And if you pass that test, then the research shows that your fetus will be fine for 5 days. So if I do it twice a week, I've covered the whole week. right? So I went in twice a week throughout the pregnancy and had this test done. They ended up delivering her by C-section just a couple weeks early because my blood pressures went up, which I don't know if, if it had been my second pregnancy, if they would have been concerned, maybe, maybe not. But I think at that point they were like, do anything we can to help this, resolve, because I was also getting a lot older at that point. And, with each passing year means less chance I can actually get pregnant if something happens with this one. Erica, I think you said you felt like you lost hope is that the word you used?
I think I mourned.
Mourned, yeah.
What I was really mourning was the potential, right? So I knew that I had hope at that point that, we would be successful eventually. I cannot even imagine the experience that you went through, because one loss was so painful. But I definitely mourned what could have been. That was the hardest part. And being around my colleagues and family members, et cetera, who had, gotten pregnant at the same time. But I really reacted, Emily, to what you said about the doctor and the hospital, and thinking about, when I had my own DNC experience, and you go to the hospital and you're waking up in the recovery room of the maternity ward with people who've just delivered babies after you've just had this DNC because of your loss. And it's just so insensitive, right? It's so insensitive how we treat people.
I used to tell people that I lost dreams. That's what I lost, right? Because there was no one pregnancy that I was more attached to than the others. And I didn't want to have 6 children, right? But it was that every time, that crushing of that dream. And people used to say to me, oh, you're having a baby. And I would say, no, I'm pregnant. My husband would look at me like, what are you talking about? But I'm like, to me, being pregnant and having a baby were completely separate. I'd been pregnant so many times and I didn't have a baby. So I would have that awkward response of, you're having a baby. No, I'm pregnant.
And I think this is why it's important to have the conversations. I've been a practicing midwife now for almost 17 years. Never, ever have I even thought about the loss of hopes, the loss of dreams, the loss of potential. For me, it was just always the loss of a life for individuals, right? Or the loss of a baby for individuals. So now, as a provider, if and when, unfortunately, what statistics say is when I do this again, I now get to enter into the room with that thought in my head. And it's crazy that I'm sitting here now like, how did I get to 17 years of practicing, not thinking about the loss of potential and the loss of dreams? And so now I get to carry that into the room when I have these conversations. But this is why it's important to have these conversations. But also, I think as providers, this is why it's important to have these conversations with our patients. From a book level, we're taught everything we need to know, but we're never taught how to be human beings in the appointment. And that comes from a passion, that comes from a desire to serve, that comes from this is what I'm going to do. And so, I went into midwifery because I felt like whenever I went to a doctor's office, I never got to see anybody that looked like me past the front desk. And so for me, I wanted to be in the Black community so that individuals could see someone whose dad went to jail when they were a child, that fought past all of that and still got to practice and have that conversation. And so when I sit down with individuals in the office, this is the human being talk that we need to be teaching and that we need to have.
So I want to tell another story, which was after my first pregnancy loss, my mom's sister called me and she said, Emily, I want you to know that you're not alone because I had 2 miscarriages before I had any children. And I said, wow, I didn't know that. I said, my mom never told me. And she said, your mom doesn't know. And I said, and does my grandma know? And she said, no. The only people that know are my husband and my doctor, because I was told not to tell anyone. So I think we're going through this cultural shift where, a generation older than me literally told no one. And then my generation, like people close to me know, but people are still afraid to talk about it, and I see a generation younger than me starting to talk about it. And I simply tell, when someone brings it up to me, I say, I'm a safe place. I've been there. I'm a safe place. I don't assume that their experience is anything like mine, right? Or that their reactions are, but that I have had enough experience that I can talk about it. And we just all need to get to that point. We can talk about, as a culture, what it's like to have a parent die, or what it's like to get a serious illness, or what it's like to have a loved one join the military or move overseas, or all sorts of things that are disruptive to our lives. But we don't talk about this, and we need to talk about it. And listening to you talk about your education and your professional development, I'm thinking, why aren't people like me and Erica called in to medical schools and to other kinds of training and say, let us tell you what happened. Let us tell you what it feels like. Let us tell you what you can do to be an even better physician when you encounter this. I don't think that's happening.
I completely agree. And, I think how different my experience getting to talk to our supporters or our patients, it's one of the greatest blessings and joys of working for an organization like Planned Parenthood is when you're out in the community. Often folks will come up to our table and share their personal story. Often it is connected with being a patient at Planned Parenthood, but we usually are also told, I don't really ever tell anybody this, or, that was my first time sharing. And we have started to invest even in more in storytelling, both through new media as we are right now, but also we have a speakers bureau where we have storytellers who are learning to share their stories in a lot of places. And one of the important ones is the Ohio State House, because, when I or our colleagues are in the hearing rooms when we're reading over the newest policy or law being passed, it's always about taking away access to healthcare. We certainly have been, unfortunately, at the forefront as Planned Parenthood. I know one of our greatest losses was we used to be funded by the Ohio Department of Health. This goes all the way back to 2016 when this was passed. But I think Erica and I can share, but the programs that we used to invest in with that money are so deeply needed. And we're actually, in communities investing in maternal and infant health care. Erica, can you share with us about Healthy Moms, Healthy Babies?
Yeah, so we used to have a program in Trumbull County and Mahoning County called Healthy Moms, Healthy Babies that was really centered on Black maternal and infant health. And we had CHWs who were out in the community. They would recruit moms at the grocery store. They would recruit moms just out in community into the program. And they had an amazing success rate of both healthy pregnancies and healthy infants after birth. So we have a state who professes to care about our infant and maternal mortality rates while continuing to pass policies that exacerbate this problem, this already growing problem. Some of these things are solvable, but they don't want, they emphasize their own ideology over what the facts and the science and the data tell us. Dana mentioned earlier CHWs. There are studies that show that utilizing CHWs in community with people is so effective in helping reduce some of these statistics. And yet the state will not reimburse for the time of a community health worker who's out in community coaching people along their healthcare journey and their pregnancy journey, when this is a huge impact on outcomes for patients and their infants. I think two of the policies that they continue to bring forward that restrict access to abortion. But miscarriage is spontaneous abortion. It's the same process of the emptying of the uterus. And what ends up happening in this case, I think, is exactly what happened to poor Brittany Watts in, I think it was Trumbull County, where there is a deficit of maternity centers. The Ohio Medicaid pays for 50% of births. Their reimbursements are terrible. They do not reimburse hospitals or providers appropriately for a healthy birth. And so more and more maternity centers are closing throughout the state, particularly in rural areas. We have fewer and fewer OBGYNs available for people to see, particularly who will accept Medicaid that pays for 50% of births. And so many people don't get to see a provider in their first trimester when it's so critical to address hypertension or diabetes or any of these other issues that can create an opportunity for premature birth, right? But these are all direct results of the policies that this legislature that's been in control for the last couple of decades have created. And I would also say that these restrictions and what happened with Brittany Watts, I think about that in my own miscarriage management perspective. So understanding that I was miscarrying, understanding that I needed to have a DNC. But I wasn't in that particular situation and I had access to the right physicians. But if I was in a situation where I didn't have access because there just are no physicians, right, which is happening throughout the state, there aren't labor and delivery nurses who are trained in these things in these ERs. And I keep presenting in an ER and people don't know what to do because the law is telling them that they can't treat what's happening. I mean, it's just awful. People die because of these policies. That is real. Something has to change. We have to stop criminalizing women for being pregnant and having babies or having miscarriages or any of these things. Like, it just shouldn't be this difficult. Let physicians and providers like nurse midwives and APRNs, let them do their job. Let them do their job and let women make choices.
And still in Ohio, it's one of the most restrictive states for nurse practitioners and nurse midwives, right? We have to do a standard care agreement, which means that I have to pay a physician to be on standby. That physician doesn't have to work with me. They don't even have to be in the state. They just have to be accessible for me to call if I need some advice or if I need a consultation. And so what we're seeing is these healthcare and these labor and delivery deserts, that we're increasing that infant mortality rate, right? Because it's making it more difficult to get to where I need to get to. I sit on the maternal mortality review committee, and we're seeing where, if they would have had access to a trauma center, to a labor and delivery unit, some of these deaths could have been preventable. We know over 65% or 63% of deaths in the state of Ohio when it comes to maternal mortality are preventable deaths. And that's just having access to the appropriate care. If we can just take the handcuffs off of nurse practitioners and nurse midwives so that we're able to truly practice to our full scope, we would see that there's access to that care. There's access to, humane care. There's access to the care where I can educate and all of those things. Even with the case out of Warren, like you said, she sought out care multiple times. We see it when we review cases all over. They seek out care multiple times. But still, she trusted the last individual who said, "I'm here to help you." And that person still sends her home. And when she reached out to that person, that's who called the police on her. And so there's still the trust system. There's still the how do we treat humanely. I think for Emily's story, the part that got to me the most was, it takes a while for you to go in labor, so stay at home. Why was that a conversation to have? And so she was forced to do that at home. She was forced to deliver at home and to see, like she said, this dead fetus and then figure out what to do with that. It's just being humane. It's being a personable provider. It's recognizing, here is what's happening. How can I be of best support to you?
I think, Dana, too, what's really standing out to me as we have this conversation about the effects on the healthcare system is both of my pregnancies resulted in emergency C-sections. So I had to have an emergency C-section with my first child because I had a placental abruption. And then I had to have an emergency C-section with my twins because, much like Emily, my blood pressure was so high, right, that I was in danger of stroke. I had access. I was within 20 minutes of a hospital. What would have happened if I had to drive an hour or more to get to a hospital before I could even be evaluated? This is what's so dangerous about this current climate that we have here in Ohio and access to OBGYN care and maternity care, and why this is what continues to create the statistics that we have here. And a large part of that is because the state of Ohio does not reimburse for healthy births. If they reimbursed appropriately for healthy births, hospitals could afford to have maternity wards. But that's not what the priority is.
Absolutely. I remember when one of the local hospitals here closed its NICU unit, and it was in a Black neighborhood. And the talk at the time, and I was still a student, was because sick babies make money. Literally, like, that was the conversation. And so they wanted to transfer that unit to the main campus so that they could get the dollars. But what we know is, in that Black community, the preterm labor risk is increased. The preterm delivery is increased. And so those are more to be those sick individuals and those sick babies. And so now I'm forced to go to this hospital to deliver and then separate from my child. And what we know, like you said, is sick babies bring in money. And we have to change that policy so that these full-term healthy babies, pregnancies, and deliveries are also praised, worshiped, and the dollars follow.
Absolutely. It comes down to what do we really value, and where are we putting our support? And for us as majority Ohioans listening, that our state legislators, so the state house, the state senate, they're the ones who get to make these policy decisions. They get to set what the state budget is. That state budget is largely what funds our local budgets, or if that money's not there, that's why you see taxes increasing locally, and you see the decisions that are being made at local or rural or city hospitals closing because they're not getting the reimbursement from Medicaid. And that's a policy decision that's being made at the state level. So they have the ability to put more dollars towards our healthcare. And they also have the ability to change the policies that are allowing barriers between more providers and providers being able to serve their community. So for everyone listening who you want to get involved, if you want to share your story, if you want to connect your friends and neighbors to these important conversations, and take the conversation into action, we hope that you'll join us first by sharing and liking and subscribing this video, of course, but also help advocate for more resources. Join Village of Healing of Cleveland, Planned Parenthood of Greater Ohio, Planned Parenthood Advocates of Ohio for organizing. And we also have some in-person happy hours happening in Athens and Cleveland coming up this month. All of those links will be connected to this video. We hope you'll join us. And if you don't see a area near you, let us know, because we do travel and we're across the state. So we hope to see you soon. This is going to be an ongoing conversation for all of us, and we hope that you'll join us. Thank you so much, Dana. Thank you so much, Emily. Thank you so much, Erica. Thank you for having this important conversation with us today. We are going to keep it going. Really appreciate your stories and your wisdom.
Thank you for all of your advocacy.
Thanks for listening. It's going to take all of us for autonomy to rise. So like, subscribe, and share. Support our work by donating to Planned Parenthood Advocates of Ohio. Visit us at plannedparenthoodaction.org. And don't forget to text CARE, C-A-R-E, to 22422 to protect Medicaid and Planned Parenthood for all.